Good evening. Today is September 9, 2020, and it is 5:30 p.m. As a quorum of the board is in attendance via video conference, I would like to call to order the public hearing of the Central Health Board of Managers regarding the district's fiscal year FY2021 tax rate. This evening's hearing is the official public hearing required by the Texas Tax Code, which we announced in our previous meeting on Wednesday, September 2nd, 2020. Notice of this evening's public hearing was published in the Austin American-Statesman on Saturday, August 29th, 2020, and has been broadcast on Travis County Television. The hearing will begin with staff's presentation of the proposed tax rate. At the conclusion of the presentation, we will invite comments from the public. To make comments during the public hearing, members of the public must either be physically present at Central Health's administrative offices or registered with the Central Health via the online form or by telephone. We will alternate between speakers who are on site at Central Health, if there are any, and speakers who have joined the public hearing virtually. I will now call upon Lisa Owens, who will be presenting. Thank you, Lisa.
Thank you. Good evening. Lisa Owens, Deputy CFO. Can you see my screen? Okay. Okay.
Yes,
great.
Lisa.
Well, I would like to present some highlights of our proposed budget as we proposing our FY2021 proposed tax rate, which is 6.9% over the Maintenance and Operations No New Revenue rate. That rate does consist of a small debt service component of 0.0589 cents per $100 of valuation and a total tax rate of 11.0306 cents per $100 of valuation. Based on the average taxable homestead value compared from last year to this year, we do estimate that this could impact the average taxpayer about $25 per year. We do have the highest allowable by law homestead exemption of 20% and an over 65 and disability exemption of $85,500. Our budget is composed of sources and uses that total $367 million. As we look at the second column of this information, just to highlight, our property taxes are our main source of funds. We do anticipate an additional $19 million in tax revenue as a result of an increase year over year, and a total of $251 million in sources of funds, with a contingency reserve that is carried forward from our current fiscal year of approximately $115.8 million. We have a structurally balanced budget. Our healthcare delivery is our main program. Over 96% of our expenses are in our healthcare delivery program at $354 million, and just over $13 million in administration. Our website has a wealth of information, an outline of the information, our past presentations, and more details, something we refer to as Schedule B, about the healthcare delivery programs, as well as an overview of all the healthcare delivery programs available on our website and in past presentations. A few highlights, this year we are increasing healthcare services by just about $19 million in our budget, as well as increasing investments in our ACA program, premium assistance program, about $1.6 million, and then $9.5 million in capital reserves for long-term capital planning. Again, total healthcare delivery program, $354 million planned for FY21. We do also maintain emergency reserves of 15% of our eligible expenses, and that's approximately $38.7 million. We are at the public hearing this evening. We've had multiple public input. Also on our website, an extensive community outreach report from our community engagement team and outreach professionals who've been working on collecting information throughout the year to inform our budget strategies and budget dollars. We also held a community conversation last week. We had a public input session last week, and also our public hearing tonight. Next week, we would be asking the board to vote on the proposed tax rate and budget, and then we would proceed to the Commissioner's Court at the end of the month. With that, I will turn it over back to you, Chair Greenberg.
Thank you, Issa. We will now take up agenda item number 2, receive public comment on the proposed Central Health fiscal year FY 2021 budget and its associated tax rate. Yvonne Davila of the Central Health Communication Department will briefly cover the guidelines for the public hearing portion of the meeting, and he will then call upon members of the public to comment. Once Yvonne has recognized a member of the public, please approach the podium or virtually unmute. If you are physically present, you can approach or unmute your phone or computer. If you're attending virtually, then state your name and provide any comment. If you're attending the hearing in person at Central Health's administrative offices, staff and signs at the location will tell you where to offer your comments. There is a 3-minute limit for comments per board rule. Yvonne?
Thank you, Madam Chair. First and foremost, people who wish to listen to the board meeting in Spanish or to public comment in Spanish can call 512-856-7677. Las personas que deseen escuchar y participar en español pueden hablar al 512-856-7677. De nuevo, ese número es el 512-856-7677. To be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail by 4 p.m. the day of the meeting. Individuals are asked their preferred language as they register to speak, and both the online form and voicemail greeting are in English and in Spanish. Or they must be physically present at Central Health Administrative Offices at 1111 East Cesar Chavez. Please note that COVID-19 protection guidelines will be followed. All attendees are required to wear masks while inside the building. We will limit the number of people who can be inside the building at a time. All speakers will be recognized by name and in the order their speaking request was received. If you're speaking at Central Health, please note we will alternate between those who are speaking online, by phone, and in person. If you're joining us by phone or online, we ask that you keep your device muted until you are called on to speak. Please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. In this case, it will be on the budget. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their time limit, we will allow 30 more seconds to wrap up their comments before they are muted. Once again, speakers will be muted at 3.5 minutes to ensure the efficiency of the meeting. Speakers may not donate their time to other speakers. As a courtesy to others and to be respectful of time constraints, please try not to repeat other speakers' comments. Depending on the number of speakers and the total time being spent in the public hearing portion of the meeting, the board chair may, in her discretion, impose additional limits or time constraints. Due to the restriction of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. And with that, Madam Chair, I will ask the first speaker to unmute their line. And her name is Olga Campos Benz. She is with HAM. Ms. Campos, would you please unmute your line?
Yes, thank you so much for those instructions. Thank you so much for everyone for your attendance. As you heard, my name is Olga Campos-Benz. I'm a HAM board member. I'm also very active in other community efforts, nonprofits, and have been for a long time. I'm here today, first and foremost, to thank Central Health for their continued support of HAM, the Health Alliance for Austin Musicians. The HAM Premium Assistance Program with Sendero is a key factor in keeping thousands of working musicians doing exactly that. They're working, and for us, it's enjoyable. It improves our quality of life. Without the CH Premium Assistance funding, these musicians would be unfunded and they would already be using overloaded emergency rooms and other charity care programs. But just as important is the fact that Central Health has provided funding and support for such an important program to our city. Austin musicians, we know this, are the lifeblood of Austin. They make living here different and unique. And more importantly than that, they help to bring in billions of dollars to the economy. We hear that from everybody from Tesla on down. Their employees want to live in Austin because of our quality of life, and that is central to being the live music capital of the world. We must continue to support our musicians by giving them access to health care through this important program. Of course, the pandemic has turned all of our lives upside down, or we wouldn't be meeting like this. We are, and we're going to get through this. But during this pandemic, it's more important than ever that ham musicians have access to affordable health care. They're not working. They're not earning an income. Those who were self-sufficient previously are like everyone else, just trying to make ends meet and survive. It is just as important that after all of this happens and we make it through this crisis, and I'm sure like each of you, you believe we will make it through this crisis, but we just have to be able to know that our musicians who are living here in Austin, they're going to get back to playing live music for us, the music that makes us such an important part of our city. Now, I know that you each received a specific ask from ham last week to not only continue funding the premium assistance program at the same level, but also to increase the funding by $641,088 for a total of $2,441,088. That would be our funding for 2021 on our premium assistance. This is going to allow ham to fund the musicians that we've had to turn away in the past due to the funding being depleted. And it was depleted before open enrollment was even over.
Ms. Campos, you are at 3 minutes.
Okay, I just want to again thank you and know that we are making inroads in helping to diversify our ham members, because we know that's an important qualifier. And we are well on our way to doing that, but we can't do it without you. So thank you very much.
Thank you, Ms. Campos. Our next speaker is, and I apologize in advance for not being able to pronounce this accurately, Shubhada Saxena. Shubhada Saxena, you may now unmute your line. Do we have anyone by the name of Shubhada Saxena on the line? Okay, we may come back to you at a later time. The next person on the list is Nakia Reynoso with ham also. Nakia Reynoso. Go ahead.
Mr. Reynoso, you appear to be muted. We're not hearing you.
How about now? Great.
Yes, thank you.
Good evening. My name is Nakia. I've been a working musician in Austin for almost 20 years now. I was a semifinalist on the first season of The Voice, a two-time Black Fret Grant recipient, and I am the president of Austin, Texas Musicians, a nonprofit focused on musician advocacy here in Austin. Having access to the healthcare coverage and support that ham provides to me is a key factor in all those successes. I'm so grateful for the continued support from Central Health of funding ham, but I cannot stress enough how access to Sendero is vital to keeping musicians healthy, and how essential this new patient assistance program has been in making it a little easier for musicians to live in our city. Musicians in Austin, we had lines of people who lined up for hours to try to access healthcare and the PAP program last year, and ham still ran out of funds. Ham does so much for Austin's musicians, and it's more than just physical health needs. Ham helps give us much needed peace of mind, because they've worked so hard to do right by musicians, building trust and proving time and time again that they care so deeply for Austin musicians. Today, I'm here to ask Central Health to make sure that peace of mind is not placed in jeopardy by not only continuing the funding that you are providing to HAM, but by increasing that funding. They need your help to fund the musicians that got left out last year. And the increased funding will help to also do specialized outreach and health navigation to our music communities of color. They've already been doing the best they can to work with folks like me and other musicians of color and other organizations to do this much needed outreach to these communities. And I would love to see that funding continue and increase to make that happen. I know that you have so many priorities and so many people are asking for help, but HAM is one of the most important nonprofits in Austin because they are both a healthcare safety net and they support the cultural arts. Austin counts on musicians. Musicians are constantly used to promote the city. We drive the economy. We help raise money for other causes. And now, as our entire industry has been upended by coronavirus and we are pretty much almost all out of work, is not only the time to continue this funding, but please increase it. Think of it as investing in Austin's cultural and economic future for when the lights do come back on. Because no one wants to even imagine Austin without music, let alone live in an Austin without music. It just won't be the same. Austin musicians trust HAM, they rely on HAM, and HAM is really helping Austin musicians make it through this time so that when
Mr. Reynoso, you're at 3 minutes.
Thank you. So when things get back to normal, we'll still be able to be here to play music. Thank you so much for your time and your continued support of HAM, and I hope that you'll increase their funding this year.
Thank you, Mr. Reynoso. We'll go back to Shabada Saxena. If you're on the phone, the way to unmute yourself is *69. If you press *69, you can unmute your phone for Shabada Saxena. Okay. The next speaker is Mr. Richard Franklin. Mr. Franklin, will you please unmute yourself? Mr. Franklin?
Am I unmuted now?
Yes.
Okay. I guess I'm sounding like a broken record again, and I'm having difficulty with this organization not living within its means and possibly even giving us a tax break. Because during this time of COVID, it has come to a situation where the people who can afford it the least are paying for those who can afford it even less. You're now asking for another tax rate, an increase in taxes on top of what the county's going to hit us with and any other taxing entity out there. The only people that are giving us a tax break is the school district. And we need breaks out here in our community. At the same time, we're asking for a tax break because you want to increase our taxes. We have not received that which has never been provided for the most needy in the community. And I'm not talking about for the musicians. I'm talking about Eastern Travis County is still waiting for you to break ground on facilities that were promised. Money was supposed to be set aside. Where's the money and where is the facility? We are still here waiting. The people in our community, which when you came out with COVID testing, had more COVID tests positive than anyone else in Travis County, and now we no longer even have the testing. It's not like we got well. We're still sick, and we're not receiving services. So what point in time do the people who were paid for services, paid taxes, get that which they paid for? And stop asking me to pay for more and take care of everyone else when I'm not getting what I should have gotten in my own community. This board needs to ask some hard questions with respect to that has not been provided that's already been paid for. Why haven't you broken ground? When are you going to break ground? And when is that going to happen? Mike Giesling should be a conversation that needs to happen. Don't come back to me and ask me for more money when you're making me pay for things that I'm not receiving. Don't ask me for more money. This is ridiculous. Have a good day.
Thank you, Mr. Franklin. The next person on the list is Kalu James. Kalu James, can you please unmute your line?
Hello, this is Kalu James. I am a musician here in Austin, and I've been here since 2007. I'd like to thank Central Health for everything they do for so many people, so many organizations, including HAM. HAM was one of the reasons why I moved here in 2007, because as a musician, you're constantly fighting a society which is having to make you prove yourself all the time that what you're doing is important in your economy and in the city that you live in. HAM has been here before affordable health care. HAM has been here since I moved here. One of the reasons why, like I said, I moved here. And I've been constantly with HAM this whole time. I have friends who use them not just for health care, but for mental services. With COVID and the pandemic we're going through, and the fact that a lot of our income has been eviscerated in the city, which is the livelihood capital of the world. Personally, the mental service that I've been able to receive through HAM is just irreplaceable. A lot of us are spending time by ourselves, having to ask ourselves all those questions of, do I need to get something that is that is less volatile, but at the same time, we're in a city where billions and billions of dollars are coming from the music scene. I really want to thank Central Health for all you're doing. I know that HAM itself is the lifeline for most of the musicians. If you consider us a car, HAM is the gas tank when it comes to the health and the mental services that is required to keep us in this city, especially with the high rise of costs and what we're going through the pandemic right now. I, as a musician of color who live here, was contacted by HAM last year in trying to include a lot more people into this with outreach. And I remember, I believe about 400 musicians were turned down last year. We cannot afford to live in this city and have a thriving community that continues to be the face of Austin in so many ways, and the reason why people move here without the health care and the mental services of this community thriving. I personally lost my dad about 6 years ago, and I can tell you that without HAM and the ability to be able to have this mental services continue to be afforded to me, it would be something totally different, maybe choosing a different career path. So I thank y'all for all you do, and I really do advocate for the increasing of the funding of Sendero PAP for HAM to continue doing this vital service for the city of Austin, for the Austin musicians, and for everything that we exist and
Mr.
live
James,
for.
you're at 3 minutes.
Thank you so much. That's it.
Thank you, Mr. James. The next speaker is Rainey Collins, Miss Rainey Collins with HAM also. Miss Collins, will you please unmute your line?
Hi, this is Rainey Collins. I'm the CEO of HAM. I'm a native Austinite, and I have a healthcare background working in public health, hospital programs, and philanthropy and development. I believe in the importance and power of public health. I love this city, and I love music. I am so proud to see the work that Central Health is doing all over our city for underserved populations. And I'm also very proud of the unique and collaborative partnership that HAM has built with Central Health and Sendero. I honestly believe that we are not only saving thousands of lives together, but we're helping to save Austin music. I spoke last week outlining the success of the Central Health Sendero Premium Assistance Program and the work that we do together to provide this underserved musician community with access to care and to help them navigate the increasingly complex healthcare system. HAM's model, which is also in part your model, is a model that music towns across the country are trying to duplicate. No other city in the nation has anything like HAM. And this successful model is in large part due to our partnerships with Central Health and programs like the Sendero PAP. It's a proven successful healthcare model and one that we should all be really proud of. This is an example of collaboration between organizations at its best. Last week, I sent to the Board of Central Health and to the staff a very bold request for increased funding so that we could serve more musicians and specifically serve more musicians from communities of color. This request for the additional $641,000 of funding just for premium assistance would not only address the over 400 musicians who qualified last year but did not get funded, but would help us address new musicians from communities of color that HAM is actively working to reach through our outreach and navigation program. The additional $150,000 that we have requested here for that would specifically fund this new program to reach more musicians of color. If funded, this too would be another milestone for HAM, for Central Health, for Sendero, and for the music community. I respect the Central Health Board's responsibility to the many needs of our community, but I am urging you to consider this additional funding request for HAM's programming. It is in complete line with the goals of Central Health, and we have both seen that it not only works, but it works well. If we had more funding, we could make an even larger impact on not just musicians of color, but our entire city, because HAM is vital to keeping our musicians here and vital to the cultural and economic vibrancy of Austin. Of note, HAM just opened our open enrollment counseling and appointment sessions 5 days ago to our musicians. We have already had over 700 musicians sign up. Thank you. I know time is short for these final budget decisions, and I will be reaching out directly to some of you and be available for questions and discussions about HAM. I also quickly wanted to invite you all to join us for HAM Day on September 15th. It's going to be virtual this year, but it's a hugely important day of fundraising for HAM and a day that celebrates Austin music. I hope you'll tune into some of the HAM social channels or our website or Fox 7 TV to get a real treat from a diverse and rich music community that shows just what Central Health and Sendero are supporting. Thank you so much.
Thank you, Ms. Collins. Our next speaker is Ms. Susanna Woody with the Del Valle Community Coalition. Susanna, would you please unmute your line?
Hi, my name is Susanna Woody. I'm speaking on behalf of the Del Valle Community Coalition regarding the Central Health Proposed Budget and Tax Rate. As many of you know, DVCC has been advocating for Central Health to build a permanent brick and mortar clinics throughout the Del Valle area for years. The current budget as presented, we feel, is more focused on optimizing financial returns through continued development of the downtown campus, rather than providing adequate healthcare services to East Travis County residents. After reading the files online, we have several concerns. First, I can't speak on behalf of the Colony Park area, but the communication with Central Health and the community that I've seen so far is not actually very robust. Most of the time, Central Health is reiterating the same things, and the community is asking for solid dates regarding a permanent facility. I don't think that the Southeast area even has an advisory committee at this time. If I'm incorrect, someone please send me the information so I can contact them and join their committee. As for the page 12, I firmly believe that entire page should be removed. As soon as the pandemic started, all of our temporary clinics were the first to be shut down. The only reason that they were reopened was because we had community outraged, and they contacted our elected officials. Let's see. Oh, the expected permanent facility in the Hornsby area was supposed to break ground in 2019. As far as I know, no date has been presented regarding any future clinical services or construction. The third paragraph, I'm assuming, was Central Health's attempt to appease the community for now. While I appreciate that attempt, we cannot sit by and allow years to pass before any dates and services are provided to the Elroy location. As for taxes, we are against any taxes increase due to the burden tax increases would put on families in the area that are already suffering financially due to the pandemic. Many of you know that our area is in poverty rates, and the pandemic has just made things worse for us. DVCC is requesting Central Health fulfill its obligations to the community, specifically the Hornsby Bend project, and start implementing and planning dates for the Elroy project before any more funding is allocated to the downtown project. We ask the board to fulfill its duty as a public health provider to the underserved communities and scrutinize the budget even more. Thank you for your time.
Thank you, Ms. Woody. Thanks for your comment. The next speaker is Mr. David King with the Del Valle Community Coalition as well. Mr. King, will you please unmute your line? If you're on the phone,
Yes.
Okay.
Yes. Can you hear me?
Yes, we can hear you. Go ahead.
Yes, and thank you. And let me just clarify, I'm not speaking for the Del Valle Community Coalition, but I am going to reference some of their comments, some of their concerns tonight. So anyway, so now I'll start. Thank you. Honorable Chair and members of the Central Health Board of Managers, thank you for considering the following comments regarding the Central Health District Fiscal Year 2021 Proposed Budget and Tax Rate. The Central Health District proposed budget and tax rate are inequitable to residents in the City of Austin extraterritorial jurisdiction compared to residents in the City of Austin full-purpose jurisdiction. Residents in the extraterritorial jurisdiction have limited access to health services while they effectively pay a higher percentage of their incomes for property taxes to fund Central Health compared to residents in the full-purpose jurisdiction. Central Health data indicates that about 6,341 residents in Del Valle are enrolled in Central Health Services, which represents about 4% of all residents served by Central Health in Travis County. Central Health is essentially forcing low-income residents in Del Valle to pay a higher percentage of their incomes for property taxes to fund health services while providing the residents with inequitable and inaccessible health services. The new Central Health Clinic at Hornsby Bend was supposed to break ground in winter 2019. Almost 1 year later, Central Health has still not provided residents with an accurate timeline for the badly needed clinic. Please provide Del Valle residents with an accurate and expedited timeline for the Hornsby Bend Clinic, and please ensure that all Central Health clinics and services in Del Valle and the Eastern Crescent are available and accessible to low-income families and vulnerable residents 7 days a week. Please stop diverting millions of dollars in funding to the UT Del Medical School. That funding is intended exclusively for medical care for low-income and vulnerable residents in Travis County. Please claw back all such transfers to date and use that money for medical care for low-income families and vulnerable residents in Del Valle and the Eastern Crescent. The City of Austin and Travis County are preparing for budget shortfalls due to COVID-19. So residents can expect more tax increases to cover those shortfalls. Low-income residents and families of color disproportionately impacted by the pandemic desperately need healthcare services now and cannot afford more taxes. Please support Del Valle Community Coalition's request to reconsider the proposed increase in the Central Health District tax rate for 2021 and to reevaluate it in 2022. Please ensure that the Central Health budget and tax rate are equitable and moral. Thank you for considering my comments and for your service. Thanks also to the staff and employees of Central Health for their service to our communities.
Thank you, Mr. King. Our next speaker is Ms. Angie Newman. Ms. Newman, will you please unmute your line? Miss Angie Newman, are you there? If you're on the phone, you can unmute your line by pressing *69. Okay. Madam Chair?
Yes, Yvonne, can we try? There was somebody at the beginning who maybe we should try again.
Absolutely. Miss or Mr. Shubhada Saxena? Shubhada Saxena? No answer. Angie Newman? No answer. And Madam Chair, I'm being notified that there are no There's no one physically present at Cesar Chavez at Central Health Administrative Offices.
Okay.
For a public hearing.
All right. Thank you very much, Yvonne, and thank you very much for everyone who came before us in this public hearing today. And we appreciate you taking the time out of your busy days and your evenings to provide this input to us. We take it very seriously, so thank you very much. I am now going to announce the date, time, and place of the meeting in which Central Health will vote to adopt the fiscal year FY 2020 budget and its associated tax rate. This is agenda item number 3. In accordance with the Texas Tax Code and as chair of this governing body, I announce that the Central Health Board of Managers will vote on adoption of the fiscal year FY 2021 budget and its associated proposed tax rate on Wednesday, September 16th, 2020 at 5:30 p.m. remotely by video conference. Members, I am now ready to accept a motion to close the public hearing. Is that Manager Jones? Did you have a motion?
I'll make that motion. If
Okay, Manager Valadez?
Yes, I move that we close the public hearing, please.
Manager Valadez has a motion. Is there a second? Manager Jones?
Yes.
Manager Jones seconds that. At this time, I will close the public hearing of the Central Health Board regarding the fiscal year 2020 tax rate. It is Wednesday, September 9th at 6:07 p.m.
I don't believe you called the vote on that, Madam Chair.
Oh, thank you. So all in favor of the motion, please signal by saying aye.
Aye.
Opposed, same sign. Any abstaining? The motion passes. Okay, so we are now closing the public hearing and we will turn to our Board of Managers meeting. The time is now 6:07 and as a quorum of the board is in attendance via our video conference, I'd like to call to order the Central Health Board of Managers for our regular board meeting. The first item of business is public communication. Members of the public who wish to make comments during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 4 p.m. today. Yvonne, did anyone register to make comments for this portion of the meeting?
No, Madam Chair.
Okay. So according to Yvonne, there was no one who registered for the public comment portion of this Board of Managers meeting. Given that, we will move now to the consent agenda. C1, approve the minutes of the Central Health Board of Managers August 19th and August 26th, 2020 regular meetings. And C2, receive the quarterly investment report and ratify Central Health investments for July 2020. Members, is there a motion?
I move that we adopt the consent consent agenda.
We have a motion from Manager Valadez to adopt the consent agenda. Is there a second? We have a second from Manager Bell. All in favor, say aye. Aye. Opposed, same sign. Any abstaining? Thank you, members. We will now proceed to the regular agenda. Members, item 5 will not be considered tonight. The item was, number 5, discuss and take appropriate action on an interlocal cooperation agreement between Central Health and the City of Austin for the realignment of Red River Street from 15th Street to 12th Street. The City of Austin has rescheduled their consideration of the interlocal agreement until October, and hence this item will be brought back for consideration at a later date. We will now move to the regular agenda. Item 1, receive and discuss a presentation on the proposed Central Health and Community Care Collaborative fiscal year 2021 budgets, including ongoing budget strategies. Members, the Community Care Collaborative or CCC budget will not be presented this evening, but we will bring this back at a later date. Lisa Owens, Stephanie McDonald, and Jeff Canoda will be presenting on the proposed Central Health budget. I will now turn it to them.
Thank you, Chairperson Greenberg. Let me open up our fiscal year 21 Central Health proposed budget. Tonight we did have our public hearing. This triggers a time period where Central Health will need to approve the property tax rate. That is a 7-day period, and you are scheduled to consider that on September 16th. Secondly, at our last board meeting, the Central Health Board approved to set a maximum tax rate of 11.0306 cents per $100 valuation. And thirdly, as it relates to our proposed budget, we have a few minor changes that we will walk through and highlight for you that differ from our previous presentation last week. So with that, you see the slide. I think we presented this slide in our public hearing. It's a common slide. I will point out something, and it correlates with the next slide. We talk about the average taxable homestead value. That is the average taxable homestead value in Travis County. And that's the amount that the tax rate is applied to. And for Central Health, this is where the homestead exemption comes into account. So the value the taxes are calculated at, as reflected in the chart, is $355,000. But the actual appraised value of a home would actually be a little bit over $444,000. So if you take the $444,000 and apply the 20% exemption that Central Health has, that gets us to the average taxable homestead value. And that can get a little confusing as you look out across the different taxing jurisdictions that have different homestead exemptions. So I just wanted to point that out. And again, just using these amounts, the average, the annual increase is approximately $2 a month related to our proposed property tax rate. Next slide shows our property tax impact statement as it relates to the proposed rate. And you see a little bit more information as it relates to both the home value and the taxable, the actual taxable value that the tax rate is applied to. You see different bands of home values that start at $150,000 and range, excuse me, range up to $550,000, and the applicable tax bill and the applicable annual increase. The preceding slide that you just saw correlates really closely with the second to the last line item that we just talked about, the line item that says the 2020 home value is $450,000. So just kind of as a apples to apples between the two slides, that's how you would a way to correlate the two. And it does get confusing when we throw a lot of numbers around based on taxable amounts and home values, et cetera, et cetera. So just wanted to explain some of the differences between these two slides and what the impact is to the taxpayer. On the next slide, we are showing, as it relates to all of the overlapping taxing jurisdictions in Travis County, the pro rata percentage of taxes based on that average value in Travis County. And you'll see all the taxing jurisdictions. You'll see Central Health in light blue kind of lined out there. What this means is a total tax as it relates to Travis County. Central Health is approximately 4.3% of that tax burden, of that total tax pro rata share in fiscal year 20. And then we have gone out and looked at the fiscal year 2021 proposed tax rates, and you see that there really isn't much change as it relates to Central Health's pro rata percentage. That percentage is 4.4%. I'm going to turn the presentation over to Lisa to walk through some more detail of our proposed budget.
Thank you.
Okay, good evening again, Lisa Owens. So I will again just hit some highlights. As Jeff said, where there's no changes to the sources of funds or the proposed tax rate. However, we'll hit a couple highlights of some changes to some healthcare delivery uses for your consideration. So again, $251 million in sources of funds, primarily made up of property taxes, a little bit of lease revenue and other revenue. And then a contingency reserve carry forward, which is a result of sources being greater than uses in FY20, will be brought forward of $115.8 million for healthcare delivery uses in FY21. So our structurally balanced budget has our healthcare delivery at over 96% of the budget at $354 million and $13 million in administration. And again, 15% emergency reserves for eligible expenses. Just to orient you to the screen, we do have a couple highlighted changes between what we presented last week. I will put my cursor right here and hope you can see it, but it's in just two line items: primary care, an increase of $1.5 million, and pharmacy, an increase of $500,000. So the only change that we're proposing is an additional $2 million that would be put into healthcare services through our network of contracted providers. In our healthcare operations, no changes, approximately $48 million in healthcare operations, which does include our ACA premium assistance programs, as well as the campus redevelopment and our healthcare facility costs for real estate and healthcare facility expenditures. In our reserves and appropriated transfers, as I mentioned earlier, and have more details to go through on another slide on capital, we're proposing as part of our long-term capital planning to allocate $9.5 million of the current uses of funds to that long-term planning. And then the corresponding increase in $2 million for healthcare services to our network of providers is offset by a $2 million decrease to the available contingency reserve for healthcare dollars. So you'll see that going from 85 to 83 million. Again, no other changes. Our total healthcare delivery stays at $354.3 million, and our administration at just over $13 million, again with no changes, for a total of $367 million in uses of funds. We are sharing a list of anticipated contracted providers for you. As you know, this will be anticipated. Contracts not necessarily executed yet, negotiations underway. But as we know it today, and as we anticipate existing relationships that may continue, we have outlined those in the packet for you and in this information. I know it's a little hard to see, but it's available for you to have plenty of time to review, and we can answer questions as needed. Again, anticipated providers based on the type of specialty and type of service.
Lisa, if I could just pause for a second. So you might ask, why are we making changes to our budget from last time? Two reasons. First of all, as Lisa mentioned, we still are just in the negotiation stages of contractual events with our providers. And we see on the primary care side that our initial estimate was probably a little lower than it should have been. And so we're asking to increase that an additional $1.5 million just to reflect where we think we'll be at both rates and volumes. And then we also increased our pharmacy by $500,000. And the sense of going into the this new year in our pharmacy budget, and just stepping back for a second, you know, we try to utilize through community care our 340B drug pricing, and there are a lot of changes that are potentially in the works related around 340B pricing, potentially around some drugs that our patients would highly utilize. So I will throw out a lot of compliments to the community care pharmacy team. They have been great in not only trying to help us and make us understand it, but I think they are very forward thinking in their in thinking through what solutions may be. But this is a high area of concern that that we have going into the new year, and there can potentially be some very volatile drug prices that can occur on a quarter by quarter basis on potentially some drugs that are, or medications that our patients highly utilize. So I just wanted to point that out to the board, that we're aware of the circumstances, but it could be a very volatile budget for pharmaceuticals this upcoming year. Thank you.
Thank you.
So we've shared this information before, and as I mentioned, and I'm highlighting it right here, we have allocated in the third column a total of $9.5 million in additional reserves for potentially cash-funded capital investments. In the longer term, we are planning for 3 new clinical locations, a component of that being cash-funded and debt financed. And I believe, as we've shared in the past, the longer term over the next year to two could be estimated at about $28 million, but those projects are anticipated to start in FY20, some again being debt financed. The other area that we anticipate work beginning on, as was mentioned earlier tonight, is the Red River realignment. We have approximately $5 million in that. And then other capital projects, which does include our investment and partnership with community care to increase our EHR capabilities and provide additional equipment for all of the examination rooms to improve the patient experience while using that EHR and the capabilities to have access to each of our exam rooms. I'm gonna turn it over to Stephanie to talk a little bit about capital planning timelines and specifically around clinical services in Eastern Travis County.
Thank you.
Thank you, Lisa. So an update on the 3 Eastern Travis County priority health centers that are included in this FY21 capital budget. Active work has actually occurred in FY2020 to advance these health centers. Tonight, we're going to ask you to take action to increase the funding available to our engineering, geotechnical, and design services, the amount of funding available for the pools to get started on some work in those 3 areas. Tomorrow at the Eastern Crescent Subcommittee meeting chaired by Manager Jones, the subcommittee will receive our health service recommendation based on patient data, what is known as a uniform data system, the UDS data that comes through the Federal Health Resources Service Administration, and our own demographic data. This is going to, we have service recommendations for both Del Valley and Hornsby Bend, and this work is really necessary for determining the building program, or what services and what space is required for those services within a building. We've already presented a recommendation specific to Colony Park to the subcommittee, and we did that last month. We've asked our clinical operator, community care in this case, to do their specific analysis, including preliminary financial analysis. And this request is for all 3 locations. We will send the data and recommendation after the Eastern Crescent Subcommittee meeting tomorrow for Del Valley and Hornsby Bend, but they have already received our analysis for Colony Park. You know, this work, in addition to design and construction planning and project cost, operating pro formas, will come back to the board in the form of a project plan that will have a comprehensive budget, and we will need your approval to advance all 3 projects during this next fiscal year. We anticipate that all of these 3 projects could be in active construction in fiscal year 2021. And that is the update. Thanks, Lisa.
Thank you very much.
Thanks, Stephanie. So with that, I will just remind everyone what we opened with, kind of where we are in this process, having our public hearing this evening, which does start a 7-day window to vote to approve the budget and the tax rate. And we look forward to seeing you back here next Wednesday, virtually next Wednesday, and then proceeding to the Commissioner's Court at the end of the month.
Thank you very much.
That,
really,
you're welcome. That's it.
Yes, thank you very much. I am very appreciative of all the hard work that has gone into this, and the updates from you, Lisa and Jeff, and from you, Stephanie, on the very important work that's going on in the eastern portion of the county. I'm excited to hear about the progress that's being made, and we'll hear more tomorrow in the Eastern Crescent Subcommittee and in strategic planning, and when we can actually be breaking ground. So thank you. Members, I know that you know, this is a very important responsibility, our fiduciary responsibility and our responsibility to the taxpayers and to residents of Travis County. The Board of Managers approved a proposed property tax rate of 11.0306 cents per $100 of taxable property value for the upcoming 2021 fiscal year. The 6.9% over new property tax rate is the same as fiscal year 2020. The proposed tax rate will result in an annual increase, as you heard, of about $25 for the average taxable homestead value of approximately $355,000. That's around $2 a month. This board does not take a $25 proposed annual increase lightly. We do not take that lightly at all. We certainly understand, especially at a time when we have higher unemployment rates and people are worried about their health during the pandemic. We take this very seriously. And we know that we must balance this with the fact that more people need care. We've heard that tonight, and we've heard that so much recently that there are, as Travis County has grown, and we saw in our demographic information at strategic planning about a month ago, what's happening with our population demographics. But as our population keeps increasing, the people who need help keep increasing. And of course, with the pandemic and unemployment, there are people more than ever who need our help, and we want to be able to do that, especially in the communities that have been historically marginalized and underserved and are now disproportionately affected by COVID-19, such as the Latino and Black communities in Travis County. We take this very seriously. It is important to note that approximately 96% of Central Health's fiscal year 2021 budget funds the delivery of health care. And that is important to us. We want every penny possible going to that direct delivery of health care. Central Health does have the lowest tax rate of any major urban Texas hospital district. And we're doing everything we can to maintain the lowest possible tax rate that we can. And part of that, as I said, is, you know, that 96% of our funds going to the direct delivery of health care. So this is a very really solemn responsibility that we have. Manager Valadez, I know you had some comments that you wanted to make.
You're on mute.
Manager Valadez, you're on mute.
You're off now.
I'm off. Okay. I want everybody listening and everybody that's watching, I want them to understand that we have to deal with a lot of needs in our communities. They differ from population or community to community, population to population, and area to area. And as a result of that, we have to make sure that what we provide to the entire Travis County population is included in the budget and has the majority of their needs, if not all of their needs, provided for. I want to make sure that it doesn't make a difference whether or not you have status or no status with respect to immigration. With respect to your zip code, it shouldn't matter where you live. With respect to your income, it shouldn't matter what your income level is, whether you're below 100% FPL or whether you have, $250,000 a year. If you want to receive services in our clinics or in our specialty care, we take everybody from the very poorest to the uninsured to those that have insurance. We take your insurance. But I want to make sure that you, taking into consideration everything that we have to, all the information that's being provided to us by staff and by the situation that we're in, we can't always tell you what we're dealing with behind the scenes. That's first and foremost, because we can't. We should be able to at least give you an update once we have gotten over our little bumps as to what's going on and why we're making the decisions that we're making. But either way, rest assured, and I say this to my Del Valley and Southeast Travis County and Eastern Crescent residents, be sure to understand that your priorities are uppermost in our minds and in the conversations that we have, whether they're in public or whether they're in closed session. They are uppermost in our minds. And we will, and we commit, Central Health commits to taking care of those needs as quickly as possible, as efficiently as possible, so that you will have your brick and mortar buildings, and so that you will be able to see services provided to you, whether there's no infrastructure in place or not. I can't agree with you more for the comments that you've made with respect to putting in and paying in taxes to the system and not necessarily feeling that you're getting back your just rewards or your just needs, basic needs. But we will do everything in our power. I believe that every board member here today will do everything in their power to make sure that your needs are taken care of and your concerns are addressed as quickly as we possibly can. And I appreciate you coming. I appreciate your criticisms. I appreciate your supports. And I do want you to know that you are uppermost in our minds. You are a priority for us. And thank you all for participating, whether we may like or not like what you have to say. Thank you.
Thank you, Manager Valdez. Manager Zamora?
Chair Greenberg, Dr. Bell, managers, I can't agree more with what my esteemed colleague, Manager Valdez, just said. I too understand what Del Valley is going through. I understand the plight of the pandemic. But I also understand, and I've been in practice for 32 years here in East Austin, and I know what my patients need. And as I've said this before in many meetings before, Chair Greenberg, my patients are your patients and your patients are my patients. So this $20 million increase is going to fund healthcare. It's not going to go to salaries. It's not going to go to things that are frivolous. They're going to go to healthcare. And I see David Evans is on the phone call as well. And I've been blessed to be on both boards, your board and Integral Care Board. Many of those patients we see on the street are homeless. They're the integral care patients. So that these monies are going to go to the right people. 5.2 million for primary care. 3.6 million for specialty care. 1 million for behavioral care. 1.2 million for people coming out of the hospital. 6.8 million for hospital and specialty services. 1.7 million for affordable care with the HAM people who are we're referring to for the assistance program. So these monies are going to be well spent. Yes, I know it's a hardship. I know it's a lot of money for many people, but we're going to use it as Manager Valdez said. We're going to be good stewards for your money. We're going to spend that money where it needs to be spent in the Northeast area, the East area, East Austin area, and the Southeast Austin area. I've been in practice for 32 years in this area. I know what my patients need. I'm going to do everything I can for them, for both boards, this board and the Integral Care Board. It's in every one of each manager's part to do this. Thank you, Chair Greenberg.
Thank you very much. Manager Bell?
Thank you, Chair Greenberg. I just want to say up front that I do hear and I understand the concerns that many of the speakers expressed about the future economic outlook here in Travis County. But as many of the managers have said, as more individuals lose their jobs and are not able to bring in wages, they still need health care. And those individuals are the individuals that we will be taking care of. I do want to point out that in this proposed budget, we are funding and prioritizing service expansion in the Eastern Travis County. I know that Manager Jones and Manager Valadez and Chair Greenberg are members of the Eastern Crescent Subcommittee, and they've prioritized the oversight of making healthcare accessible in the Eastern Crescent. While we've made strides, like opening a clinic in Hornsby Bend and rolling out a mobile clinic in Colony Park and Creedmoor, we understand that for the residents living in these communities, the progress hasn't happened fast enough. And we wish it could have happened faster. But the proposed budget supports our commitment to expand the services in Eastern Travis County. Central Health, if I'm correct in hearing the budget tonight, is planning new clinics in Colony Park, Hornsby Bend, and Del Valley. And as always, the community will be a vital part of this planning process. Construction of these clinics, I'm told, in Eastern Travis County is planned to start in FY 2021 and maybe as early as FY 2020. Central Health's long-term capital planning budget includes $28 million to fund 3 new clinics in Travis County. And the funding is planned throughout FY21 and 22, and it will be based on individual project timelines. Throughout the design and construction of the new clinics, not only will Central Health staff provide monthly updates, but the Eastern Crescent Subcommittee will be updated on the progress in this particular area. And we hope to have this done by the end of FY 2022. Thank you.
Thank you, Manager Bell. Anything else before we move to the next slide? Manager Jones, yes?
I'd just like to echo what my colleague Manager Bell just said, but I like to look at it from the other side of the lens of the citizens. I agree with everything what my other colleagues have said. It was mentioned that in FY19 we talked about some of these facilities. We're here in 2020 talking about opening these facilities. The likelihood of these facilities being opened by the end of 2021, I would hypothesize, I'm not sure, and maybe the CEO can speak to this, are probably unlikely either. So the question we need to address is, we don't want to create a false impression that these facilities will be up and operating in 2021. We're hopefully, as indicated, to have dirt started hopefully by the end of this year, and hopefully up and operating to some degree, hopefully in 2021, but the likelihood is it may not be. So well, I don't want to give a false impression to the individual, because I don't want to be here next year hearing this same message from some of the same citizens that we promised them something that we cannot completely deliver. So I want us to be straightforward in explaining that it is a possibility these facilities may not be online. Hopefully they will, and hopefully CEO can speak to the likelihood of some aspect or all of them or some being operating in 2021. So I just want that noted for the record. The second thing, just one other thing. The second thing is when we talk about the average taxpayer contribution, and we talk about the area of Del Valley, we're talking about $25. We're not actually saying the average taxpayer in Del Valley is going to be $25, because there those prices, those averages range. So we're a little talking about a little less than that, if I'm correct. But I think we need to make sure taxpayer understand there will be an increase, but it may not be the same, obviously, across the board.
Thank you, Manager Jones. Those are both very important points, and certainly you're correct about timelines. There are frequently things that are beyond our control, locating land, for instance, and then being able to negotiate on that land, or permitting processes within the city of Austin, for instance, that we can't control, that can take many months. So I really appreciate those comments. And likewise, when you're talking about the tax rate, yes, that was the average value. To the extent that someone's home is of a lesser value, then it wouldn't be $2 a month or approximately $24, $25 annually. It could be less. If their home is valued more, then it could be higher. Thank you, Manager Jones. Important points. Yes, Manager Musaitov.
Thank you. I definitely echo everything that my colleagues have mentioned, and definitely support everything that they've said. And I appreciate the community for speaking forth before us this evening. And we are definitely in unprecedented times where health matters to everyone, we're not just healthcare, and that's something that we as a board are fully committed. I understand the concerns the community have brought forth. I was on the board since 2019, and we're still discussing the same issues. Hopefully we can have a more permanent solution, but in the meantime, for the short-term solution, I would want us to navigate the possibility of probably increasing some care there. And I know that will be addressed in Mr. Jones' committee. Now for HAM members, I know that many of them who are vital to our community have lost their jobs, and I was hoping that this, as I mentioned, we are in unprecedented times. If we can increase their funding to fulfill more care, especially 400 individuals who are in dire need at this critical time. So I support the increased funding for them. Thank you.
Thank you, Manager Musaitov. Anyone else before we move to our next agenda item? Please just signal or shout out if I'm not seeing you. All right, members, I'm not seeing anyone else at this time.
Manager Valadez has
Manager Valadez, yes.
Chairperson Greenberg, is this a time for us to bring up our questions regarding the central health budget, or are we just going to remain silent on that right now? Because if it is, then I'd like to echo what Manager Mustaitov brought up, and a couple of other questions that I'd like clarifications about.
Certainly.
Okay. Can I ask you all to please go to Lisa and Jeff, if we can look at page on our central health budget, page 35. Okay.
I'm sorry. On this budget that we just presented?
Yes, that one right there.
Okay.
You're exactly on the page I needed you on. Thank you.
Okay, great.
Down to where it talks about healthcare operations. You have healthcare services. Yeah, healthcare operations and support. I know in one of the pages that we got some language on the proposed 2021 budget, it addressed the $7 million for Sendero. And I want to make sure that here, when it's under for ACA Healthcare Premium Assistance Program, because it's a CHAP, I'm assuming we were talking about the CHAP expense for premium assistance or coverage. With respect to the HAM request, is this a reason why it's almost $11 million as opposed to just what Sendero had, because it's going to incorporate some of the other entities' requests for additional assistance? And would that include under the next line where it talks about education and enrollment, that outreach amount of money also?
Sure. So the $10.9 million includes approximately $8.6 million to the high risk program. Last year, that budget was $7 million. That was enrollment start. You know, as you know, our fiscal year and open enrollment are not completely aligned. So we have an increase in there. So $8.6 million for the high risk program, and then approximately $2.3 million for the existing CHAP program through Sendero, which I believe includes the HAM and SIM program.
Okay, and the
can I
next
add
one?
a little bit to that?
Okay, please, Jeff.
Just generally speaking, it adds about 100 additional members to our CHAP high risk program.
Okay.
And the HAM SIMS budget in this proposed budget is relatively flat.
So what does that mean, relatively flat? There's no increase, or we're not going to accommodate their ask for increase? Is that what you mean by flat?
I'm saying that it's that, actually, to be quite honest, tonight was the first that I've heard of the request for the increase. So I know we're in COVID. There may have been a letter that was sent. We
to the board members
did not see that. And it would be great if we could have some discussion related around that item to give us a little more guidance on the finance side related to that item.
Well,
okay.
I appreciate that, Jeff. And yes, I'm surprised that you didn't actually get that, but I will tell you this. You know, as much as I support all our Travis County residents and their access to health care, I'm so concerned about the fact that we have a high risk group that hasn't been enrolled, and we have a high number of uninsured in our Travis County population. And when we fund ACA enrollment, and when we fund ACA premium healthcare assistance, I think those are the two populations that we're actually reaching out to. And anything that we could do to accommodate those requests should be prioritized, because that is our mission. Our mission is to provide assistance and address the medical needs of those most in need in Travis County. And when you're talking about people who have lost their jobs, whether they be musicians or not, whether they be in the MAP program, MAP Basic, or are uninsured completely, and we have not reached out to them, I think those are the things that we really need to be prioritizing.
So, Manager Valdez, I have a question. Are you saying that you're supportive of the HAM request for the additional funding?
Yes, because
okay.
I think they're reaching out.
That's what I thought I heard. Thank you.
Yes, because they are reaching out to the uninsured population.
Right.
And to me, it really doesn't make a difference whether they're musicians or not. So long as I know that we're reaching out to the uninsured and the needy, the job.
Yes. Thank you, Manager Valdez. Can I ask that I know we had some of the HAM executive director present. If the HAM executive director could get with our finance staff, with Jeff or Lisa, and update them on this, because apparently they did not get the information. Or Jeff or Lisa, if you could reach out to them, would that be acceptable?
Absolutely. And as I understood the request, it was for an additional $641,000. And as it relates to our budget, we would take that from our contingency reserve appropriate.
Okay.
There was also a request for $150,000 to do outreach and enrollment specifically in the minority musicians.
I think that may have been part of that overall request, Manager Valdez. Let's let
We'll get that confirmed by the executive.
yes, let's let Jeff and Lisa get with Ham and work on this for us.
And I just want to make sure that Ham and Sims are working together because you know, we're supposed to be the live music capital of the world. Right now, we've been relatively not alive, and indeed. But I wanted to make sure that we also consider we have a huge uninsured population out there that we really need to do a deep dive into. Okay.
Thank you,
Manager Greenberg.
Yes.
Chairperson, I'd just like to piggyback on what Manager Valdez says, but I don't want them to just talk about they're going to do outreach into these minority musician communities. I want that documented.
That's right.
I mean, because one of the things Austin is great for is, yes, we're very culturally diverse, but we're not able to clearly document it.
That's right.
So before we approve funding for these efforts, and I am supportive, I want to be straightforward. And I've heard Ham has indicated they're going to do a lot in terms of outreach into our communities. But my question is, why hasn't it happened before now?
That's right.
Well,
So
Manager Jones, I think that's an important point, and I think that point is in line with what this board has been saying for some time now with various constituencies and contractors, and that is we need to have performance measures and outcome measures. And so it sounds like that there's a lot of support, and I am also supportive of this, but that we need to have the Ham executive director get with Lisa and or Jeff and work this out and come back to us and look to see what kind of performance measures and outcome measures could be part of it. Manager Jones, is that in line with what you're thinking?
That can be documented.
Yes, that can be documented, of course.
Yeah,
of course.
Yes, that's exactly.
All right, thank you. Manager Valdez, did you have a quick question?
Just a real quick comment. And that's one of the reasons that I was asking for the enrollment situation from Ham. And the reason for that was because they talked in terms of they were enrolling using our funds for the premium assistance into Sendero. But they were also enrolling with additional funds, some of their musician members into other insurance programs. And I wanted to know, that's still one of the reasons I wanted to know where we were at as far as the numbers and then the demographics of those people that they're enrolling in both entities. We want to put Ham on record as making sure that they comply with the diversity and take into consideration the demographics because of Travis County, because not all musicians in Travis County are white males. And that's historically whom they have enrolled, not even white women. So I'm concerned about that. I do appreciate, and I want to thank Renee Collins for having admitted to not being a priority for them, reaching out into my musicians' world of color and language. And I want her to understand that we are now going to be holding her accountable for this. So thank
you, Manager Valdez. I'm going to ask again staff to get with her and come back to us. Thank you very much. Managers, I'm scrolling. Is there anyone else before we leave this side and move on to the next one? I'm not seeing or hearing anyone. So unless you give me the sign or shout out to get my attention in this maze, then we will move to the next item. Okay, seeing and hearing nothing from other managers, we will move to, there was no motion necessary on this item. We will move to number 2, receive and discuss a presentation on Community Care Health Center's fiscal year 2021 budget. Dr. Jason Fournier and Joy Sloan will be presenting. Members, as you may recall, Central Health does not approve the community care budget because that action must be taken by the board of the community care under the health center program requirements outlined in the Public Health Service Act and its implementing regulations. So no motion will be necessary on this either. I'm going to now turn it over for our presentation.
Thank you so much, Chairperson Greenberg, and good evening, Board of Managers. Hopefully you guys can hear us okay. Joy and I are sitting in our administrative offices, and we've got masks on. If the presentation could be brought up, that would be most helpful. Great, thank you so much. So if we could advance to the first slide, we know that we've got limited time this evening. So this is a draft of our budget. As you'll see, the budget will be presented later this month to our board of directors here at Community Care. I know this is a busy graphic. I won't go through this in detail, but I do want to highlight that year over year. So this is calendar year data, and this is data that's submitted up through the Uniform Data System report within the Health Resources and Service Administration, which is a national data set as it relates to the health center program. As you can see, we saw in calendar year 2019, we saw a very diverse patient population, of which we served 116,175 unique individuals. That was up almost 18,000 unique individuals from the year before, of which about 94% of the patients we served have incomes below 200% of the federal poverty level. 85% of the patients that we served were drawn from communities of color, 67% of which were non-Hispanic, or sorry, ethnically speaking, were Latino Hispanics. When we take a look at insurance status, I'll draw your attention down to the bottom right. That's for all our populations, inclusive of pediatrics, adults, and older individuals. 55.26% of that 116,175 unique individuals were uninsured in calendar year 2019. If we can advance to the next slide. And this very quickly, because I know this is in your packet, is just a breakout as it relates to a 3-year trend analysis of disease burden. And this is really as a proportionality of the entire patient population we serve. So overall, we actually saw a reduction in 2019, calendar year 2019, of chronic disease within our patient population. But that's also explained by the fact that we added a significant pediatric population to our overall service delivery. And that's where a lot of the growth, we would have grown organically by about 3,000 to 4,000 patients year over year from 2018 to 2019. But with the acquisition and absorption of Carousel Pediatrics into our overall system of care here at Community Care, we also saw an increase in the patient population through them by about 13,000 unique pediatric patients that joined our overall service. And that resulted in a reduction in the overall chronic disease because, as you would expect, children really suffer to a less degree for the chronic diseases that are listed on this screen. This is just a trend that we keep track of among many other quality metrics and outcome metrics. We can advance to the next slide. So as we've been considering what's going on in 2020, and then thinking forward into our upcoming fiscal year, there's several different external pressures that are being brought to bear relative to our overall budget planning and thought that needs to be put into the budget planning process. Foremost is really continued issues with sustainability of the health center funding program, and specifically the health center trust fund itself. That continues to be at risk. If Congress fails to act by the end of November of this year, 70% of health center funding will be compromised. For Travis County Healthcare District and Community Care, that translates into roughly $4.6 million. But there's a ripple effect across our entire system in terms of capacity to serve as a result of that. The other factors are similar to last year. We continue to see a shift away from Medicaid to more uninsured, and that, as others have actually indicated this evening, is being exacerbated by the coronavirus pandemic, and we're seeing more individuals uninsured. But that was a trend. Unfortunately, Texas continues to lead the country in uninsured, and again, that's being exacerbated. The other part relative to COVID-19 or the coronavirus pandemic is its direct impact on our expectations and service within the community. So for example, earlier this year with the stay-at-home order, our ability to serve community members was compromised in terms of their ability to come into the clinics. We very quickly, as you're aware of, stepped up telehealth and telephonic and telemedical visits, but there was only so much we could do on that. So as a result of continued persistence with coronavirus, we are expecting to serve more than what we would otherwise anticipate from a face-to-face encounter perspective. We're also looking at a decrease in our earning potential under the delivery system reform incentive payment year over year. In the current budget year, we expected $10.5 million to be earned through those clinical outcomes. You'll see Joy will present where we are year to date and what we're expecting year to date, which is about $6.5 million of that $10.5 million. But 7.4 is anticipated for the upcoming fiscal year. Similar to coronavirus, but fortunately not with the same impact on patients, is our Epic implementation, which will bring about some greater efficiency, our ability to communicate better amongst healthcare providers, and also provide a state-of-the-art electronic health record system to our teams that very much deserve that technology. But in so moving forward with a new system, there's going to be a reduction temporarily in terms of our ability to serve the community as we're training folks up. So that's anticipated as well. And as Mr. Knodel indicated, there are significant changes that are happening around the 340B contract pharmacy initiatives that we have. We're still evaluating that. It's not built into our budget specifically right now, but it is something that we're watching very closely. If we can advance to the next slide, I'm going to hand it over to my colleague, Ms. Sloan, who is our Chief Operating Officer, to talk a little bit more about some of the assumptions we have in our 2021 fiscal year budget. So Joy, loud.
Thank you.
Yes.
So currently we have about 34 delivery sites that are approved by the Health Resources and Services Administration. We are looking at new clinic additions that are expected to occur during the new budget year. The Aikens High School, School-Based Health Center in Chalmers. We're projecting an overall increase in FQHC patient encounters. So these are encounters that count toward our FQHC total. 457,000 encounters are budgeted, and they include about 10,500 in therapy encounters, physical therapy, occupational, and speech. Pathology, those came with a carousel acquisition, and about 1,400 additional encounters for the 2 new clinics addressed above. The budget also projects a loss in service capacity due to the implementation of Epic. So about 10,014 encounters are what we're saying if Epic will impact us. And then we have about 39,500 encounters that we're saying are going to be lost because of the coronavirus pandemic response and some of the challenges that patients are facing with coming back into clinics and dental, pediatric care, implementing telehealth and those kinds of situations. Projecting increases in the federal healthcare reimbursement rate. So for Medicaid, CHIP, and for Medicare, we projected about a 2% increase in our reimbursement rate. Next slide, please. So central health related revenues projected for our primary care agreement, we are projecting an increase of 0 right now, but we're still in contract negotiations. And so there's a potential right now between 2.7 and 4 million in additional revenue depending on those contract negotiations. And then for the delivery system reform incentive program, we expect that the contract will continue to be based on 4 measure bundles, which include 25 quality measures with some lower earning potential because of the impact that COVID has had on the ability to bring patients face to face for those encounters. We have an increase in some of our operating expenses. Salaries were increased to reflect the merit and competitive market adjustments. We did not add new positions into the budget. Positions related to coronavirus and new sites, such as Aikens and Chalmers, are included in our new initiatives and are projected at about 3.1 million. Our benefits increased to reflect the fact that employee health insurance costs have exceeded premiums paid to date. And for our joint technology operating costs, they increased about 2.9 million. About 875,000 of that was new software or upgrades to our software, and then about 2 million of that was the new Epic related expenses that come along with implementing that new software. Some of that will be offset in the next year's budget when we're able to give up some of our existing some of it's going to overlap for about a year. Supplies are increased to reflect a projected 3.5 million increase in pharmacy costs, but that is offset by expected pharmacy revenue.
So next slide, please. So when you take a look at this, I think while we're projecting a reduction as a result of both the pandemic and our EPIC implementation, you can see there's significant growth even comparative to FY 2020's budget. We're jumping from 387,000 to 457. The best way to think about the impact of EPIC and coronavirus is those two together, we're losing about 10% of what we would expect in capacity otherwise. And for the very real reasons that Joy's indicated, patients are less likely to be using services on site. We're taking our cue from our patients. We've done a lot relative to telemedicine and telehealth. You'll see that that's normalizing now in a slide or two ahead. But also coupled to that is that we have to practice social distancing, right, within our dental operatories and make sure that there's adequate spacing in our waiting areas. So all that's been put into play to make sure that we have a very safe environment for our patients as they're coming into our clinics, and that certainly has been the case. On the right-hand side of the graphic that you're seeing here, this is percent change back to 2017. So this is really a 5-year run rate with the budget forecast for 2021, the 5th year. So you can see we've increased the total number of encounters over the last 4 years into this new fiscal year by 33%. That's a significant increase, obviously. Next slide, please. Similarly, here you can see the trend as it relates to both medical and dental, behavioral health, and then we're also demonstrating for the first time the addition of our therapy services that are directed towards our pediatric population, and that's inclusive of speech pathology, occupational therapy, as well as physical therapy that now are being provided through community care services. We also have additional specialty services that are lumped into the medical services. So next slide, and I'm going to hand it back to Joy to walk us through some of the numbers here in terms of how it's playing out.
So this slide will show you the approved budget for our current fiscal year, 2019 to 2020, where we are projected to end the year, and then the proposed budget for 2021. For a total patient services revenue in about the middle of the page, we budgeted 77 million. This year we're going to end at about 95 million. Next year we're budgeting about 102 million. For grants, we've been running about 12,500,000. We've increased that a little bit with our projections of 14.6 because of the additional COVID funding that's come in. We're budgeting 22 million next year. And that 22 million includes about 4.5 million of the federal COVID awards that we received. We can spend it over 12 months, and we're throwing a portion of that into next year's fiscal year starting October 1 to help offset the decrease in revenue that we're experiencing still related to COVID. Then we have other revenue. It's about 25.8 million in our 2021 budget. And most of that is made up of the central health agreement, and then about 7.4 million, 7.5 for district revenue. So that brings our total revenue for the proposed budget at 150 million.
And you can see, you know, a very significant increase from FY 2019 budget that you would have saw right around the same time. It was early October we presented last year. So it's an increase of about 35 million. There's a couple of different drivers behind that. Probably the biggest one, well, no, not probably, the biggest one is our pediatric program and its expansion through Carousel. But also you'll see that pharmacy services is driving some of this as well, and that becomes very apparent where we're seeing almost an $8 million increase in our pharmacy line, right? So next slide, please. Joy's going to talk about expenses now.
So on the expense side, you'll see salaries and benefits are budgeted at about 106.9 million for next year. That's inclusive of all of the carousel activities. Plus, we also built into here our testing initiatives for the next year, which are being offset by whatever FEMA funding we can draw down to offset those. And then we have direct care expenses. They're running about the same. And our indirect care expenses, the big increase we've seen there is with information technology at 6.4 million. And that's where you're seeing the impact of the EPIC addition without the offset of the software we have to carry for a year. So otherwise, total expenditure is 153.9 million. And right now, we're currently at a loss of about 3.7 million. These numbers will experience a little bit of change over the next couple of weeks as we continue to tweak our expenses and our revenue, but that's where we land right now.
And I think what Joy pointed out that's important for the Board of Managers to have awareness around is there are some one-time only costs. We're hopeful that we get a year from now, coronavirus is not at the same level it is, and we're not testing as much. The other thing to note, though, within the salaries line is that in addition to the additional outlay relative to Epic, we have added some additional personnel, both from a billing perspective and as well as from a joint technology perspective in terms of FTEs and supporting Epic. Next slide, please.
So for a quick summary, our projected loss, 3.7 million. Right now, we have potential revenue of about 2.7 million on the current contract negotiations. Those are still in discussion. That would leave us at about $1 million loss. Again, that loss is likely to go up just a little bit as we have some increase in expenses that are needing to be rolled into the budget. So the draft budget will continue to change. It does not include any new requested positions or expenses from some of our internal operations. As Jason mentioned, it does include additional expenses related to Epic, bringing billing in-house. We currently do part of that through a partnership with a revenue company. So we have to add some positions for that, and then the additional joint tech positions for analysts to support the build and carry out the ongoing operations of Epic. We have the Board of Directors of Community Care scheduled to approve the final budget September 22nd, with the Finance Committee communicating that they are really looking for a net operating margin of 0.
Next slide, please. So really looking towards the future, right? Always difficult. A budget's only as good as the time frame in which you're forecasting, right? And as we've learned very much over the last year, best laid plans can be blown up by a pandemic, right? I think we've responded very well as a collective enterprise. I'm so proud of the team members here at Community Care and our partners at Central Health. To date, we've provided almost, well, this is a little outdated, almost 28,000 tests within the community. If you looked at the dashboard as of this morning, last week's results going from August 30th through September 5th demonstrate a positivity rate of 12.5. Next slide, please. So all of that stated, we're trying to predict the future as best we can. And so one of the things that we're looking towards is the potential for Congress to intervene again and provide stimulus monies relative to COVID-19. As Joy indicated, already included in our budget as a carryover from the existing awards that were provided back in March, April, and May, allowable for 12 months is 4.5 million. That's backfilling some of the hole that we would have otherwise had. The other is we're seeing an increase. We have an opportunity to increase our telemedicine, telephonic visits to offset the continued fear relative to face-to-face. And what we've seen, and what you're seeing as a trend line, is really getting closer to what we would normally be providing in services. So you see that graph down at the bottom right dates back to mid-March. You can really see when the stay-at-home orders hit, and then where we are right now is about 90%. As Julie indicated, the biggest obstacles that we have really are on the dental front. Even though we know there's a lot of need there, our ability to meet that need has been compromised by our need to make sure that there's a safe environment for both patients and staff and social distance. And so we're looking at alternative hours, a whole bunch of different things as we continue to move forward. Next slide, please. So this is just a trend rate all the way back. I think most of the Board of Managers recognizes that in 2008, 2009 is when the health centers transitioned from the city of Austin into community care. And our first year of operations really was March of 2009 as community care operating the clinics. And so what you can see here in green is the unduplicated patients. What's in blue, the larger bar, is the number of unduplicated face-to-face encounters. And up at the top is what you can see is what we're projecting 49% uninsured in the coming year, last year being at 55.26%. So that trend line is the uninsured level in terms of overall service. And then what you're seeing in that red line is in the middle, the orange line, I should say, is proportionally what Central Health's contract or budget, when we first started, was a grant, then it moved to a contract with the CCC, and now is a contract with Central Health. You can see proportionally of our budget what percentage is actually derived from Central Health. So this forecasted year places it at 29.41%, and then the red line below is the monies that we are expecting relative to DSRIP, and you can see that last year and this year are projected to be the lowest amount that we'll receive through DSRIP as well. And so seeing that as a Central Health related program as well, that comes through the IGT mechanism, as you know, it places overall about 35% of our operating budget will be derived from Central Health related tax sources. Next slide, please. So one of the things that we look at and we've shared with before is this cost effectiveness, right? So we're not going to read through this, but you can, we're not the average health center. We're large, but we also have unique programs, right? Healthcare for the homeless, our HIV program, a lot of initiatives. And when you look at a cost per encounter on those, they're going to be substantially higher than our overall rate. Just like you would expect the cost per encounter for pediatrics to be lower. So our overall rate per encounter is projected to be about $328 and change for this upcoming year. That's up substantially from what we had in the budget last year, but there's a couple of variables that are being put into play here. Significant investments in Epic. If we looked at just the software operating and personnel, there's about $5 million in operating expense that community care has increased on an annualized basis as a result of that. And then, of course, is what Joy and I indicated earlier, which is a reduction in our ability to serve the community based on coronavirus, coupled to our Epic implementation. If we control for that and normalize it for what it would have been otherwise, it actually would drop our rate down to 296. So we think in a year's time from now, we'll actually start seeing the gains from Epic, hopefully a resolution of the coronavirus pandemic. At the same time, we're going to aggressively, with you as our partners at Central Health, look at ways to continue to expand our services. Next slide, please. With that, that concludes Chairperson Greenberg, our presentation for this evening. We greatly appreciate the time to update the Board of Managers in terms of where we are and where our investments are in this upcoming year. And as always, we thank you for your support of the communities we're so privileged to serve.
Thank you so much. We're deeply appreciative of all of the extraordinary efforts of you and your staff and Central Health and Sendero and our entire enterprise, but we really appreciate the extra efforts that you have gone to during this difficult time. And the expansion of pediatrics is certainly exciting. So thank you very much. Members, this is not an action item. Do we have any questions, members? I'm looking. Manager Jones, Manager Valdez, and then Manager Musaitov.
Yeah, thanks very much, Doctor, for the overview. It was very helpful and very useful, and thank you for the service you're doing for our community. I'm very impressed with all of the hard work you're doing, especially during this pandemic. Just a couple of quick questions. The first one is, in your presentation, you indicated that your new clinics were going to be at Palmer's and Aikens High School. In light of our discussion this evening that I think you may have been privileged to, where does this fit, or how does this compare with our discussions of having facilities out in Hornsby being up and operating? Does that imply that the current facility that's currently there will be the operating facility for Hornsby being for all of FY21?
I think, Manager Jones, it's a great question. The assumption from our part at this point in time is yes, the modular is, given the time frame to be able to break ground, secure the permits. So we're thinking, and this would be something when we come back to our board as there's more details in terms of when both potential new Del Valley replacement site for the existing site for the modular in Hornsby Bend would come online. We would go back to our board with an adjustment or adjustment to our budget reflective of that. But the timeframes right now are so uncertain that we didn't include it in the planning as of yet. We are working very closely with your staff to project out the operating needs at those sites. and looking at the sustainability of those sites as well, sir.
Okay, so with that said, I think it's important at our meeting tomorrow that we re-emphasize that, because I'm not sure everyone's on the same page in understanding that. I am now, and I think our subcommittees are, but I think we just need to emphasize that point. The second question relates to that also is, given that that's the only site that we currently have, and given, as I understand, we're limited to operations out there to 3 days a week, given my understanding your budget impacts in terms of your cost model does not necessarily allow us to expand to 5 days a week, do we as a board need to look at supplementing or supporting expansion out there for this year and also into next year in order to build the capacity to maintain the portable, as well as build the capacity for a new site? Because my concern is we're sending mixed messages. If we're going to have a facility out there, we have a temporary one, it's not currently used. Obviously, we're not going to turn around and say, next year we're going to build a new one for something that's not being used. So I'm trying to see, how do we message that and engage the community to build the capacity with what we currently have so that we can make the case for 2021 being up and operating. Can you speak to that a bit?
Yeah, absolutely, Manager Jones, and such an insightful question. I think our commitment to the Austin's Colony Hornsby Bend with the modular temporary site was we were going to operate 3 days a week, Monday, Wednesday, and Friday, but we were more than willing to increase that to 5 days a week once there was sufficient demand demonstrated by the community in the local area. Now, the clinics, as was communicated through public comment, opened in March or end of February for a very short period of time, was temporarily closed as a result of the pandemic for about 3-4 weeks, and then has been reinstituted, reestablished. We predated that with home visits, and so we're working with you as our partners at Central Health to continue to get the word out. We want that resource to serve its well-intended purpose within the community, and I think we stand ready to add clinical resources to that site when there's sufficient demand. Now, we're spreading it Monday, Wednesday, Friday. I think as it relates to your question, if we want to commit additional resources that are unused, then community care will need to have help with that because we have other needs within the community we're trying to address at the same time, just from a financially prudent perspective, sir.
Thank you.
Okay, so thanks very much. I think we're on the same page, but back to the question we're going to be discussing tomorrow at the
Yes.
County is building capacity out there, because it's a chicken and an egg. If we don't market, people won't come. People don't come because they don't know. And so we have to build that capacity. So thanks very much, and we're looking forward to working with you on that.
Thank you, Manager.
Thank you very much, and we look forward to continue discussion tomorrow. Let's see, Manager Valdez, did you have a quick question?
Yes, I do. I have a couple, and they're totally different sides of the spectrum. So I'm going to start with the second one first. You know, as we're looking at what the pandemic has done to us and the lights that it's forcing us to shine on the inequities that exist in Travis County and elsewhere, and knowing that our poverty population and our minority population and our language speaking population have been most impacted. I'm wondering whether or not, Jason, y'all have considered increasing the number of the footprint, the clinic size that you will be building to take into account or the possibility of other pandemics hitting us in the future. I know that there will be more growth out in that area. I believe that we're going to have another some kind of healthcare crisis that we're going to have to address. And so the design of the buildings that you're going to be putting out there, have you taken into consideration, like I said, expanding the footprint and accommodating what would have to happen so that we don't close the clinic because we can't comply with the social distancing or the physical distancing requirement? So that's number one. Do you want to answer that first?
Yeah, Manager Valdez, a great question. And I think as it relates to, so with our partners at Central Health, who are helping with the infrastructure, as you very well know, and greatly appreciate the support that you guys provide as the board to these projects. This is about right sizing not only for today, but for future as well. And so as we take a look at expected growth, but also anticipating if there were a smaller facility, and that's not what we're anticipating in Del Valley, for example, we're talking in Del Valley proper, a multi-provider site with pharmacy services, dental, Austin's Colony, Hornsby Bend, working on that as well. So what we need today versus what we need into the future. But if it is a smaller site, there's ways for us to mitigate risk relative to airflow and that as well that was never contemplated in the site. So we'll be able to do that as well. The other interesting thing that's accelerated our learnings here at Community Care is that not all of this has to occur within the four walls of a physical building, right? So our ability to do telehealth, our ability to do telemedicine, our ability to make sure, one of the things that we are learning through the telemedicine initiatives that we've stood up is that a lot of our patients have trouble with connectivity. So what can we do to support that as well? So all of those factors, as you very well know, Madam Manager Valadez, are going to need to be considered, but please be assured we're taking those factors as you've outlined into account as we're planning for the future needs of these facilities.
Well, the reason I asked that is because I'm not through. The reason I asked that was because I was concerned about almost 40,000 less encounters. And you know, that's significant because we didn't have the right size clinic to accommodate the need of what we didn't realize was going to happen. So now that we have experienced it, again, we want to use this as a lesson learned and look to the future for accommodating future viruses and crises. So thank you.
Manager Valadez, if I could speak to that just for a moment, that reduction is based on patient utilization and demand for services as we've peaked and valleyed on the virus. The stay-at-home order really reduced for very real reasons the ability to serve folks. We weren't able to provide preventative dentistry for 8 weeks. And so we're trying to forecast as best we can, knowing that there's going to be, unfortunately, we and much greater public health experts, we know that we've gotten through this first wave, but that's just the first wave. We don't know what the second wave looks like, unfortunately. Hopefully it's not as bad as what happened in June and July locally here.
Thank you. And so the other question, and then I'll be through, with respect to your employee benefits, if you could go to that screen.
If someone can pull up that screen.
I'll just look at it from.
So it would be on the expense, a couple back.
Page 10, page 10.
Thank you.
The expense and operating margin trends, 1920 compared to the 2021 budget.
Two more back, please, or three. It's the one with the green on it, the next one, yep.
Yeah, it has, right, that's it right there. Okay, so if you look at the benefits under expenditures, your benefits is going to go from 16 million to 22 million 700. And I noticed that you said that there had been some more medical expenses for your employees, okay, than expected. So I'm asking whether or not you have a health benefits manager who is looking at how can we create efficiencies. Do we need to go on a different healthcare plan? Is your plan Sendero? Just curious because we'd like to support Sendero, and whether or not there are other someone who specializes in looking at efficiencies for the employee and the cost to the company, which is what your budget needs to pay for and which we will pay for. So I was just wondering whether you need that.
Yeah. Manager Valdez, so it's a great pickup. What we would point to is that there's also a substantial growth in the overall salaries, and a lot of that is attributable to the additional staff that's been added. So the vast majority of the growth within the benefits is actually new staff, tied to our EPIC implementation, tied to new billing staff, tied to new pediatric staff. We've grown we're at over 1,200 employees now at community care. And as it relates to the health insurance program itself, we do partner, and actually this is through Central Health, because this is a Central Health, because as you know, we buy back essentially our employees through Central Health for all Central Health employees. And so Frost is helping us on the management side. Our current insurer is Aetna, but we made a switch from United Healthcare. But there have been conversations with both Aetna and Frost about the ability to look at how we can lower our spend. And we've had some conversations about whether or not we should consider partial or fully self-insured. And those are things Mr. Canodal, Lisa, Mike, others that are being evaluated. We looked at it this year, and of course with human resources, just timing did not allow that amidst the coronavirus, but that's something we're going to go ahead and return to next year as part of our planning. I think we're projecting, Joy, it's a double-digit increase for health insurance this year, right?
Yeah, I think we put about 15% increase in the budget for health insurance based upon what we're seeing this year. I will also add too that we failed to mention on the salaries, the other piece that drove that up was bringing behavioral health inside. So we saved on the contracted side and then increased the salaries was a wash, but that also affected the benefits as well.
Okay.
Thank you.
I appreciate that. Just one quick comment, Jason. In the state of Texas, speech therapy is equivalent to teaching services. So a speech therapist carries the same weight as a teacher is a speech therapist. And so I don't know whether you're charging, if you have Medicaid clients or people that are coming in, children, especially in your pediatric section, utilizing those things, they can get, I don't know if you're billing for the therapies that are being provided by y'all.
Yeah, we are, as Joy indicated, Ms. Sloan indicated, yes, we are, but thanks for raising that as well. We weren't sure if we were going to be able to when we first took on the therapy services, but that turned out to be true.
Thank you. Anyway, I tell you, because from 0 to 3, that's one of the qualifiers for coverage by school systems in public education is the need for speech therapy. So just thank you. You're giving kids a heads up.
Manager, let's see, did Manager Musachev, did you have something? I'm trying to remember.
Yes, you did.
Can we go back to the full view of the people present? Thank you.
Thank you. Well, thank you, Jason. I really appreciate your presentation and your team member. Thank you. I'm going to try to go as quickly as possible. Well, first of all, I want to commend you on stepping forward during this pandemic. You've done a phenomenal job, and I want you to know how much your work is much appreciated, especially by everyone in this community. Thank you so much for going above and beyond your call of duty. Now, in terms of right now in prevention, and we know in a couple months, flu may hit with this COVID. I just want to know what your preparation is in terms of prevention. Are you having a campaign? Because I know other clinics are doing drive-through flu vac shots. I wonder if you have some in plan. And I think primarily that is. And if you can just elaborate more, why would an Epic implementation cause so much disruption in your encounters? Again, and one last thing, if any next few months in terms of unexpected with COVID, I asked any clinics or any of that reducing capacity that you come forth and let us know about your plans beforehand. Thank you.
So, Manager Mustaifas, the last question broke up, and so if we can come back to it in just a moment. So as it relates to Epic, we're actually projecting very conservatively a loss of 10,014 encounters for our entire implementation, and that's as it relates to training. And so in order for our physicians, nurses, medical assistants, medical admitting clerks or receptionists to be trained up on the software. They actually have to be pulled at a clinic, and we have to be able to train them up. When we go live, though, the expectation is that we're running a normal schedule, and that's the guidance that we've had. And so having been through this several times, our process as it relates to the Epic implementation really is nominal in overall impact for our service delivery. It would have been 467,000 versus 457,000 visits. As it relates to influenza, ma'am, as it relates to our preventative services and initiatives, we very feel strongly that the next strong messaging, and actually we were talking with partners earlier today, inclusive of Central Health, is that we have to strengthen the message around the need for influenza vaccines. We did secure, prior to COVID, about 32,000 vaccines, which is fairly typical. We use almost 100% of those. Those will be directed to our patient population. With 116,000 individuals, we need to be able to conserve those vaccines for our patients that need them, that don't have access to vaccines elsewhere. Now, with that stated, our pharmacy department has worked on identifying an additional source of 10,000 vaccines, and we're working to secure funding to support that, because as you saw, right now our budgetary means doesn't allow us to secure that. If we're successful either through philanthropy or somewhere else to secure that funding, and then our intention is to do drive-through immunization vaccinations for community members who otherwise have access to no other source of vaccination. Additionally, we have asked multiple sources, including public health, as to whether or not the national stockpile will make available influenza vaccine, which would then pass through the State Department of Health. And that answer is still pending at this point in time. We don't know if there's going to be an adult vaccination program or an increase in what's available through the Vaccine for Children's program. I think, yeah, sure, please, Manager.
You talked about the funding. How much is that?
Right now, it's $150,000 for those 10,000 additional vaccines is what it's been communicated to me. I have that right, Joy? Yes. She's saying that's correct.
So you're below, your budget is below 150,000. Is that what you're referring to?
Right now, we're projecting a deficit for the year of 3.8 million. We're trying to narrow that gap, and as Joy indicated, we think that we're close to, given where contract negotiations are on several different funds, a loss of about 980,000.
No, I understand that, but in terms of the vaccination for the influenza, that was really what I was referring to.
I apologize.
So what are you, in order for you to implement a drive-through flu vaccine, how much would that cost you?
For 10,000 doses, and these are not the high dose for the older population, that's not what we have available to us. Right. $150,000 to secure 10,000 doses.
Okay, thank you.
Yep.
And my last question was more of a comment. I hope, we don't know what the future will predict, but if you have to close any of your clinics or whatever plans that you have in the future, please let us know about beforehand and have a plan as you always do. Just, we want to know, we want to be in the know. Thank you.
Yes, Manager Masita, we definitely want to be in the know, and we want to have ample time to do some outreach. So appreciate that. And Jason, do keep us updated on the immunizations if you're able to locate more and what that funding situation is. Thank you. Managers?
Just one last question.
Oh, yes, Manager Valdez, yes.
Yes, Jason, I'm just asking because I'm always in my public, why don't you have public meetings? But, you know, I'm kind of acquiescing to that. But at least for the budget, have you all thought about, has your board considered having at least a public hearing on the community care budget side, just curious? And are you all, is your board of directors 51% FQHC requirement of MAP?
Yeah, as it relates, Manager Valdez, to your first question, which was? Oh, yeah, as it relates to the board, there have been no discussions with the board about a public hearing relative to our budget. I'll bring that to our board of directors' attention, that came up this
And
evening.
also at least a public or a public comment section at the beginning of the meeting, just curious. If you all will consider that, please.
I'll relay that ask to them. And then Cynthia, your second question was?
Was the 51% FQHC?
Yes. Unequivocally, yes. We're fully compliant with the health center board requirements of minimally 51% of our governing board needs to be comprised of active patients or consumers of our health centers for the service.
Thank you. Thank you very much. All right, members. If there's nothing else, we will move now. And thank you so much, Jason, and your staff for being here with us this evening and providing us very valuable information. Please pass that along to others who worked on this and weren't present this evening. Thank you.
Thank you.
Members, we will now move to item number 3, receive and discuss a presentation from Integral Care on services and programs provided in fiscal year 2020 and future opportunities and challenges. Hal Katz and Ellen Richards will be presenting.
Good evening, everybody. Can you hear me okay?
Yes, sir.
Okay, excellent. Well, very nice seeing you guys all again. Hal Katz, Chair of the Integral Care Board of Trustees. I'm one of 3 of your appointments, along with, as you know, Dr. Zamora and Trish Young-Brown. It's a privilege to serve Central Health in that capacity. As you also said, I'm joined by David Evans and Ellen Richards, who are available here at the end to answer any questions you guys may have. As requested by staff, I'll make some brief remarks. You'll also find some materials in your packet that we've put together that go into more detail on how we're doing and what we're doing within Integral Care. I've got to express my appreciation to both you managers as well as your staff for all the hard work that you're doing in serving the community. It's invaluable work and is helping create that foundation of health that's essential for everybody to reach their full potential. As you know, Integral Care is the local authority for mental health and IDD for Travis County. We are a governmental entity focusing on improving lives of people with mental illness, substance use disorder, and IDD. Our original fiscal year 20 budget was just over $106 million and has been increased to $113 million now with some of the adjustments that have been made. Our budget for next fiscal year is at $111 million, a decrease of almost 2%. We are grateful for the Central Health investments in Integral Care, which for fiscal year 2020 through all of the Central Health organizations was just over $10.5 million with a one-time allocation of $500,000 for COVID positive individuals needing hospitalization. This fiscal year, of course, as you know, we've had some significant changes in our relationship with community care, ending the behavioral health integration programs, Emerge and Reverse Emerge, that have been in place for almost 2 decades. For fiscal year 2021, we're looking at an investment from Central Health just over $8.5 million, which we are, again, grateful for. Integral Care directly serves approximately 30,000 people each year, positively impacting the lives of 10,000 more through our helpline, our collaborative service relationships, network providers, training and education. Looking ahead, we're excited about a few opportunities. Our board has established a racial equity task force to ensure that Integral Care has in place what's necessary to ensure a workforce and care providers that allow people to feel a sense of belonging. Our new assisted outpatient treatment program, as well as our collaboration with Dell Medical School and Travis County Probate Court to support adults living with mental illness, to improve adherence to mental health treatment plans. We're implementing the Zero Suicide Initiative designed to change culture and systems to reduce suicide, and increasing access through technology, such as implementing chatbots to improve access to critical services through our web and mobile devices. We're launching My Health Point, a patient portal supporting client-driven care, creating an integral care mobile app to enable single-click features to reach critical services. Now, as you guys have heard this evening, all healthcare organizations are facing some significant challenges in the upcoming years. COVID, of course, is increasing the need for mental health and substance use disorder services while impacting our capacity to provide services and maintain safe care delivery for clients and staff, much like community care has described this evening. Integral care's outpatient capacity cannot keep pace with this community need. Substance use disorders and associated needs continue to grow, and our community struggles with a fragmented navigation and care delivery system, as well as funding sources being insufficient to meet the need. People experiencing homelessness are 18% of our clients and 40% of those we serve in crisis. The challenge continues to grow without sufficient housing to create a foundation for health and recovery. So the fiscal picture is not pretty. Tax caps on local government will impact the ability to keep pace with the increasing need. State budget crisis will mean no new revenue to address our growing needs. And the end of the 1115 waiver in 2022 will reduce services that are available today. Our collaboration with you guys will be more important this coming year than ever before. We look forward to working together closely to resolve our most pressing healthcare challenges through innovation, increased efficiencies, and better coordinated care systems. We're here to answer any questions. We appreciate the opportunity to present to you this evening.
Thank you so much, and thank you for your service that is so necessary to our community and the time that you're spending, and also managers and more. Thank you for your service and both of you, your dedication, and to all your staff who's present with us here this evening and not present but hard at work, we know. So thank you very much. Members, there is no action necessary on this item. Right. If there's nothing else at this time, then we will move on. Yes, Manager Valadez.
Chairperson Hal.
Yes, ma'am.
I want to thank you all for being there. My daughter's been in NHMR through Integral Care, through whatever, all the iterations of the acronyms for all her life. And she's 29 years old now. And I just want to tell you that we thank you for the services that you provide. Now, I have seen a great need of services from the secondary, let's say the school system, as they transition into community. There appears to be a gap in that fluid transition. A lot of parents, you know, because I was in ARDS, I lived in ARDS, and so that's where we take care of the different components. And moving into community, where now they're forced to deal with the reality of the situation without their child being in a school system who's going to take care of them and provide for their needs. Are y'all looking at tightening that transition up any better? Okay, because there are gaps, and I know your case managers sometimes get overwhelmed with the number of cases that they're having to deal with. But the Latino community is a relatively young community. So, you know, and I'm seeing lots more and more of our kids being diagnosed, and sometimes incorrectly, as ED as opposed to autistic, or somewhere in the 250 numbers of types of autism. And so I would love it if you guys would at least do some training to the diagnosticians in the school systems, so that they can understand better the differentiations of what children's behaviors are actually symptomatic of, and tightening up that community piece right there from school system at 22 to the community.
Thank you. Chairman Katz?
Definitely noted, David. I don't know if you want to respond specifically to those comments on current efforts to address those issues succinctly.
I might suggest that what I would suggest is that we follow up, because it's probably not something that you had
Nobody may be interested
information here this evening. So I'm going to ask, please, that we just follow up with that.
Will do.
Thank you.
Thank you. Yes.
Thank you.
Thank you. All right. Managers, no motion necessary on this item, so we will now move to agenda item number 4, discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus and new development in eastern Travis County. Stephen Lamp, Stephanie McDonald, and Rachel Toronjo will be presenting. Jeff Canoto and Mike Giesel are also available for questions.
So this is Jeff Canoto. I'm going to kick off, and this is an action item. We're going to ask for action related to a memo that was in the packet, included in the packet. And so this action item entails a previously approved Central Health Board of Managers item related to professional services. Ms. McDonald alluded to that in her presentation on the budget. And so in 2018, the Central Health Board of Managers approved establishing a pool of vendors related around architectural and engineering, civil engineering, commissioning agents, geotechnical engineers, and land survey services. In 2018, the initial budgetary amount overall, the not to exceed amount, was for $150,000. This process was a competitive procurement process. The firms we've listed, the firms that were selected for each professional service category that I mentioned. The request tonight is that we increase the pool size from $150,000 to $750,000. The additional $600,000 is available in our capital budget, and it will entail us or enable us to avail these services much quicker than going out through an individual procurement process for each service, for each project. So we are trying to utilize our pools to the best advantage to help us expedite the construction services related to both the Eastern Travis Crescent clinics and the Brackenridge campus development. I also do want to point out, just as a technicality, that on the memo, the fiscal impact on the very last of the second page, it says funding in the amount of $6 million. It's funding in the amount of $600,000. So it's the difference between the $750,000 request that we're asking for tonight and the initial $150,000 approval. So Rachel or I or Stephen will be happy to answer any questions if there are any. Thank you.
So thank you very much, Manager Bell, and then Manager Valadez.
Chair, would you like to put a motion on the table?
Yes.
To discuss?
Yes. Yes, please.
I move that the board delegate to the president and CEO the power to execute various contract amendments to increase the cumulative not to exceed amount available for architectural and engineering, civil engineering services, surveying services, and geotechnical engineering services by a total of $750,000 to expedite construction work in the priority areas in Eastern Travis County and on the downtown campus.
We have a motion. Is there a second? Manager Valadez, seconds. Okay. Any discussion? Manager Valadez, yes.
Yes. I appreciate that you put the hub participation or the level, but what I'd like for you to do is when it says 100%, I don't know what you mean by estimated hub participation. I don't know if that means women-owned business or does that mean minority of color?
All right, let's find out the answer to that. Thank you.
Yes.
Yeah, thank you for your question. I think it means either. So the definition would be either minority-owned or women-owned business.
Historically underutilized business, yes.
We have had this conversation before, and I'm the person that said I don't want to see if it's just women included. Also, I want it disaggregated. So it's your Anglo, if you're Anglo woman or you're Black woman or you're Latino woman. I mean, that's fine, but I want to know whether or not it's just 100% because it's all females and they could be Anglo as opposed to Latino or Black. And then we have zero Latinos or Blacks in here. So I'd like to know if you could tell us that.
Thank you.
Yes,
and I have asked for y'all to start aggregating, getting the data, compiling the data.
Let's get a response here. Thank you.
Sure. Yeah, thank you for your question. Sure. So the solicitation was done in 2018. We can follow up and provide that additional information.
Thank you.
To you. Thank you.
All right, let's follow up with that. Thank you very much. Manager Jones, yes.
So in supporting this, is there the implication that we are going to be more aggressive in getting that diversity that Manager Valadez just spoke of?
Thank you.
Because I think her comments, and I agree with it, is that we say a lot, but we don't produce, we don't do it. So what assurance do we have by voting to support this increase that we will have that replicated in what we come forth with?
So to answer your question, I think we have two choices. So right now we have a pool and we can research the questions that were asked, related to the makeup of this existing pool, or we can go out for solicitations and be as aggressive as we can to try to encourage additional participation in the solicitation process. So at least from my perspective, there seem to be two choices. We can go out for a new solicitation and aggressively encourage hub participation in these services, or we can utilize an existing pool with these current amounts that are in an existing pool.
Well, I appreciate you being frank with me on that question. One of the concerns has been addressed, and Mr. Gieslin's aware of this, is that we've met with community groups about the participation, particularly of the underutilization, I should say, of African-American vendors with us. So if what we currently have is not working, then it seems to me perhaps we might need to look at going out and do another solicitation if indeed what we currently have is not producing.
Mr. Gieslin, do you have additional information?
Thank you. So you'll recall, or perhaps, that back in June, a hub work plan was presented, and we have since talked about coming back to you all with the disparity study, and these will be items of discussion next week at the executive committee meeting. As far as the additional work, in addition to a hub disparity study, that will come back in October, as we indicated when we do project updates around our hub work. Now, one of those items, and again, there was a lot in that work plan, I don't expect you to recall it from memory, centered on how it is that we collect hub information, because there's some things that we can do to improve upon that, given that hub information is volunteered. So, and I'll defer to either Lisa or somebody else to go a little bit more specifics on the collection of that information.
Is there someone who can respond to the specifics? Because it is important to understand who actually we're contracting with. Is there someone else who can add to this?
Well, I'll follow up a little bit. I think we are hindered. So we are attempting to get the information on our own as we solicitate for future solicitations, but we are hindered by the current structure that we collect data from. And when I say that, usually it's another party that collects the data. It's typically the city. As Mr. Giesland mentioned, we are engaging, and we will attempt to gather that data as expediently as we can. But as it relates to this particular item, we're a little constrained by just the data that we had at the time of the solicitation.
Manager Valdez?
Managers, if I may.
Yes, Mr. Giesland.
I'll defer to Manager Valdez.
Manager Valdez? You're on mute.
Since I came onto this board in 2015, Sherry, and you know this for a fact, I have been asking for you all to ask the simple question in all the forms. When you take it, you ask for information from an entity who wants to do business with us, that we ask them to tell us basically who owns the business, or if it's a board of directors, give me the demographic makeup of your board of directors. If you want to be designated a hub, then we need to know not only are you Anglo or female, black, white, black, brown, Asian, whatever. No, it has to be disaggregated. It needs to be, that's the only reason, that's the only thing we have to look to, because we refused previously to participate in a disparity study.
Oh, Manager Valdez, yes.
So that just asking the question, real simple. I can't believe
it. Add on to this.
Ask the question.
If I can add on to this, Manager Valdez, yes, I have directed staff, and I know they're in the process of doing this, at looking at us participating in a disparity study for this very reason. You're correct, Manager Valdez. And I think that staff's going to be reporting back to us shortly on that participation in disparity study. Is that correct?
Yes, that is correct.
Madam Chair, a disparity study is required so that you can set a goal. Okay?
Yes, I'm aware of that.
But I'm not, since we did not do it, in lieu of that, we could have at least asked the question, okay?
Understood.
Who owns the company? Are they black, white, brown, yellow, female, male?
Yes.
Okay?
Manager Valdez.
I want to go back and repeat something, if I may, Chair Greenberg.
Yes, please.
And so I want to repeat something that I just said earlier this evening. The disparity study is one important piece of our work with hubs, because you're right, it gives us a lane to go down so that if there's any legal challenges to anything that we do, to be more deliberate in working with hubs, that we're on safe ground or we're in a safe harbor. But that's just one piece of it. The other piece of this, as I mentioned earlier, is a work plan that staff has put together that takes us now all the way through next year of things that we can do in addition to the disparity study. And one of those, as we pointed out tonight, is on the data collection piece. And we agree with you at staff level. Our data collection, it needs some improvement because it's based on some systems that made sense at one time, but now, especially because we want more refined data sets, not just generally, do you self-report as hub, that's going to take some doing. So that's one of the work deliverables that we owe to you.
Thank you, Mr. Giesland. And yes, Manager Valdez and Manager Jones, I do concur that we need better data, and we need to look at how moving forward, we move forward with better data. And I think these projects, whether the disparity study combined with this other project yes, what we need, the better data collection will put us on that path. Managers, is there anything else at this point?
I just have one more thing.
Yes,
with this motion on this action here, is there something, Jeff or CEO Mike, that do we have to actually pass it today because we've got projects pending? Because that makes a difference in voting for this immediately, because it's an action item. But please take into consideration, we can do that by making phone calls. Staff can make a couple of I'll go make the phone calls, and just.
So I think the question is, and it's a good one. why do we need to take this action tonight? Are there projects that are pending that would be slowed down, for instance, that we're trying to expedite if we don't?
Yes. We are trying to utilize services as quickly as we can. So if the board's will for us to come back, we can try to answer questions for next week's meeting. But we would like to either have action to access these services, or we need to go out for resolicitation. We need to know that ASAP.
And how long would that be a lengthier process, right?
That's probably about at least a 3-month process.
A 3-month process. Okay, Mr. Giesland?
I think it'll be longer than that, actually. Yes, thank you, Chair Greenberg. And Rachel Taranjo is on the line as well, and I'll ask her to provide some additional information. But if I'm not mistaken, whenever we put together these pools, we brought this back to the board, and if almost all of them, if not all of them, these were approved pursuant to board action. Is that correct? Could staff on the line say yes or no?
Rachel, is this something you can respond to?
Yeah, sorry, Mike. Can you clarify that question?
Yeah. Let me ask a little bit differently. This pool was put together with and pursuant to board action.
Yes, absolutely.
Okay. So the reason that we did this is because we knew at some point in time that we were going to need to be able to move faster. And by having these pre-approved pools, and this is a recognized procurement practice, you're able to get the necessary capacity. Now, what we're asking you to do tonight is take an action that we've previously brought to you before, but expand the dollar amounts, because there's work that we need to start. And a lot of it's around the site development process, and that's an important part of the work. And so you want to make sure that you can not have that slow it down, but have it be done correctly. And so by expanding those dollar amounts, we can go to that pool that's been pre-established, initiate those contracts and get the work going. And then we can go to the next step. So, and that's what we're asking you to do tonight, is to simply to expand the dollar amount. If you want to go back to what was prior approved, then I think that's going to be more than 3 or 4 months.
Okay, so can I ask a question, Mr. Giesland? This is for very specific services, the way I'm reading it. It was pre-approved pool for architectural and engineering services. And you're saying if we have to go out again, it would take more than 3 months, and we're trying to expedite some of this. Will we have in place, architectural and engineering are very specific services for all of these projects, clinics we're building in the Eastern Crescent and other things. We're going to need additional services as we move from phase to phase. You purchase land, you do design, architectural and engineering. Will we have new places, these new processes in place when we go out for new contracts, so that we can get the kind of data we're talking about and whatnot?
I'm not advised on the data collection piece. I do know that in terms of our outreach and promoting central health,
right,
as diverse and inclusive, and wanting to work with hubs, and so that's one piece that I think that we can have in place. But I need to defer to Lisa and Jeff and others that are on the call as to whether or not that data collection piece we put into place, because some of it I think is contingent upon implementation of a software system, if I'm remembering correctly.
All right. Anyone else have anything to add?
Can I call the
Sure.
question?
This is Lisa. I can just add that it is part of our plan to enhance the work plan that we shared with you. And I'm happy to revisit it again with another formal update next week as we are coming back on.
Thank you, Lisa.
Issue, but it is part of collecting the data at multiple data points instead of just at what did we spend. And so we are working on that, and that is a longer term plan, because we have to and then collect the data before we would report out. But we
We can also do more manual review of our existing documents to provide that if necessary.
Manager Musaitif, did you call the question?
Yes, I did.
Okay. So Manager Musaitif has called the question. Managers, is there anything else we need at this time? This is an action item. Okay. So we're going to go ahead then and vote on this item. All those in favor signify by saying aye. Aye.
Aye.
Aye. Okay, any opposed? Same sign. Any abstaining? All right, one abstaining, Manager Jones. Thank you. Thank you, managers. Okay. I now move that announce that the board is convening in closed session to discuss agenda item 4 under Texas Government Code section 551.071, consultation with attorney, and Texas Government Code 551.072, deliberation regarding real property. And managers, agenda item number 6 will be taken up, discuss in closed session, discuss and take appropriate action on the 1115 Medicaid waiver, delivery system reform incentive payment, open paren, closed paren projects, the Community Care Collaborative, and other healthcare delivery partners, programs, projects, and arrangements, including agreements with Ascension, Texas. And that agenda item number 6 will be taken up under Texas Government Code section 551.071, consultation with attorney, and Texas Government Code section 551.085, governing board of certain providers of healthcare services. So managers, we all need to completely exit this now, and you were sent a separate meeting line for our closed session. So I will see you in a few minutes. Thank you. Okay, do we have a quorum here? All right, so managers, the time is 9:06. It's Wednesday, September 9th. We have concluded our closed sessions on agenda item number 4 and agenda item number 6. We are back in open session. Agenda item number 7, confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting, where we will vote on the proposed tax increase, is scheduled for next Wednesday, September 16th, 2020 at 5:30 p.m. remotely by video conference. At this time, I'm ready to accept a motion for adjournment. Do I have a motion? Motion by Manager and second by Manager Jones. All in favor? Aye. Aye. Opposed, same sign. Any abstaining? None. Managers, thank you very much for a very productive meeting, and thank you to all the staff and public who have participated. We deeply appreciate it.
Thank you.
Thanks, everybody. Good night.
Good night.
Thank you. Thank you, members.